Thank you. Please be seated. Sorry for delay. You must know these are difficult times. Good afternoon, ladies and gentlemen. The Vice President, the Prime Minister, Deputy Prime Minister, ministers, members of the press. COVID-19 remains a serious global health pandemic. Namibia registered her first 2 confirmed cases of COVID-19 on 13th March 2020. It is why on 17th March 2020, government declared a state of emergency, which was extended by Parliament for a period of 6 months. To date, the number of confirmed cases stands at 16. Of these, 3 people have made full recovery, and there has been no report of new infections for over a week now. We responded with urgent and aggressive measures to contain the spread of the novel coronavirus into our communities. The measures we have put in place are starting to bear fruits. As stated in my first statement on COVID-19, the health of Namibians remains the first priority. Repeat again, the health of Namibians remains the first priority. COVID-19 is not only a threat to the lives of the Namibian people and the public health system, but it also bears secondary negative economic impacts on businesses, including jobs and livelihoods. Our key priority has been and shall remain the curbing the spread of the disease and minimize it. Today, Cabinet met and reviewed progress on the extraordinary measures we have adopted of the dual purpose of protecting the health, security, and safety of our people and the economy. The current lockdown for Erongo region and Commerce regions, including the local authorities of Windhoek and Report lapsed on Friday, 17th April 2020 at midnight. The lockdown is necessary to curb the spread of COVID-19. It is in view of this that government has decided to introduce further measures as follows. 1, the lockdown will be extended from midnight on Friday, 17th April 2020 to midnight on 4th of May 2020. Effectively, the country will reopen on 5th of May 2020. During this period, movements within the whole country will be restricted. During this period, movements within the whole country will be restricted. The regions will be grouped into zones. The exact modalities will be worked out by law enforcement agencies. Since we want to give you full information, let me add at this juncture the collective effort, call on the Minister. I told you I'm in a situation room. Prime Minister is in the charge of ministerial activities, technical committee by Minister in charge. Just to update you on certain things, I'll give you a floor before I conclude.
Thank you very much, Comrade President. On the 31st of December 2019, China notified WHO about COVID-19 outbreak in Wuhan city in China. On the 30th of January, the outbreak was declared a public health emergency of international concern by the World Health Organization Director General. Since then, the COVID-19 situation has evolved rapidly within and outside China, involving over 180 countries. The risk of international spread has been determined by the very high and outbreak has spread to all regions of the world. Namibia registered her first 2 confirmed cases on the 13th of March 2020. And by the 4th of April 2020, the number of cases have increased to 16. 13 of the cases are travel-related and 3 are local transmission. Namibia has not registered any COVID-19 related deaths. The cases so far have been contained to Khomas, Erongo, and Karas. On the 17th of March 2020, His Excellency Dr. HAGE GEINGOB declared a state of emergency for the whole country on account of COVID-19. And then on the 27th of March 2020, at 23:59, 2 regions, namely Khomas and Erongo, were put under lockdown to last until the 17th of April 2020. The reasons for putting the 2 regions under lockdown is to maintain maximum suppression of transmission as a result of exposure of these regions to international travel. When COVID-19 was announced to the world, the Ministry of Health and Social Services activated the Health Emergency Management Committee to prepare the country for a possible outbreak of COVID-19 in the country. On the 3rd of February 2020, the Right Honorable Prime Minister established a multi-sectoral and multi-skilled National Health Emergency Management Committee, chaired by the Executive Director of the Ministry of Health and Social Services, to spearhead the national response to coronavirus. A costed response plan was developed and is being implemented. It involves public awareness and information dissemination about the disease, as well as preventive measures. Health personnel was trained in various aspects of COVID-19. The Namibia Institute of Pathology was capacitated to do confirmatory tests locally. Infrastructure development was undertaken to provide facilities for quarantine, screening, diagnosis, treatment, and counseling. Contact tracing was intensified. Medical equipment, medicine, and personnel protective equipment were sourced. At all material time, the public was informed of all development. The public sector was joined by the private health sector, the business community, and individuals in terms of cash and in-kind support. The contribution of the media has been indispensable. The response benefited from the exceptional leadership of His Excellency President Dr. HAGE GEINGOB, the support of the Right Honorable Prime Minister, and the entire cabinet. Individual countries and development partners continue to play a big role in terms of financial, material, and moral support. The sum total of these efforts resulted in the fact that Namibia recorded only 6 cases during the currency of the lockdown of the 2 regions. 3 COVID-19 patients were cured and discharged. So far, we have not recorded any death due to COVID-19, a mean feat indeed. Notwithstanding the noteworthy performance by Namibia, the job is not yet done. We are facing a new disease of which much is still to be learned, and to be understood. COVID-19 is characterized by high intensity of transmission, extremely low immunity of the population, abundance of infective and susceptible individuals, and a wide geographical distribution. The rate at which COVID-19 infections spread depends on the basic reproduction ratio, which is a measure of expected number of cases directly generated by one case in a population where all individuals are susceptible to infection. Epidemiologically, to keep the outbreak under control, the basic reproduction ratio must be kept below 1. While the lockdown has been effective in minimizing the movement of people, the reported cases indicate a slow rise in detected COVID-19 cases in Namibia. If one takes the mean value of 2.3 as the basic reproduction ratio, 5 cases of COVID-19 will generate 244 cases after 4 cycles and 36,643 cases after 10 cycles. This observation makes a compelling case for a countrywide lockdown and an extension of the lockdown period in order for the new regions to benefit from the lockdown process and the existing regions to consolidate the gains made so far. The purpose of the lockdown is to suppress transmission by reducing the possibility of asymptomatic people with COVID-19 from further infecting others in the community. Whilst a lockdown inevitably limits people's right to freedom of movement, such limitation is justified to protect public health. The goal is to ensure that each confirmed case infects less than 1 person on average. It is proven that this level of transmission interrupts the growth of the epidemic, commonly referred to as flattening the curve. The current lockdown in Khomas and Erongo regions has not been efficient. There has been a breach of interventions with implications for potential community spread within the regions with confirmed cases, with a risk of wider spread in the entire country. I will give a few examples of this breach. For example, our case number 9 was diagnosed on the 25th of March, that is 2 days before the lockdown came into effect. The case had a total of about 7 secondary contacts outside the nuclear family. These cases were discharged from quarantine without extended laboratory testing. There is therefore a small but practical risk that some of the asymptomatic cases discharged from quarantine might be infectious, thus needing an extended period beyond the quarantine period to conduct surveillance to rule out possible infection. Case number 15. Case number 15 breached the self-isolation regulation while waiting for his results and was out and about in the community when the diagnosis was confirmed. Against the recommendation for not using public transport when seeking health care, the case took a taxi from his house to Robert Mugabe Clinic for admission to isolation on the 7th of April 2020. There is a potential, therefore, that several contacts of this case may not be identified. And if these contacts became infected, it could potentially mean some community spread might have been seeded by this case. If the last contact to this case was on the 7th of April, this would mean that their incubation period will end up on the 28th of April. This is 21 days after the last contact. This case was accompanied by 3 South African nationals who may still be within the country and their whereabouts are not known. Case number 16. It was diagnosed on the 5th of April 2020. He too breached quarantine procedures and continues to work while waiting for his test result, interacting with more than 50 people. This case was taken into isolation only on the 6th of April. Furthermore, the travel history of this case and the interaction with the visitors remain disjointed, leaving a potential that this case could either have been travel-related or acquired locally. If we assume that the last contact of this case before going into isolation was the 6th of April, it would mean that his last contact would need up to the 27th of April to be sure that we have confidence that these primary contacts have gone through the whole incubation period. About 85 travelers arrived at Hosea Kutako International Airport via a flight from Johannesburg on the 26th of March 2020. These travelers were coming from various parts of the world, some of which might have been affected by COVID-19. This group was not sent into quarantine and went on to complete their destinations across Namibia. In the absence of full quarantine for this group, there is a potential risk that some individuals within this group might have been infected and in turn seeded community transmissions of the disease, which is yet to be determined. Again, on the 25th of March 2020, 33 travelers from COVID-affected countries arrived via Walvis Bay, but were allowed to go home without being quarantined. This group poses the same risk as those described above. Given the scenario above, it is clear that the outbreak has not been suppressed. There is a case for a countrywide lockdown. A further period of countrywide lockdown is required to suppress the further spread and save lives by ensuring that all people remain in localities where they currently are. This is to ensure that people who are not yet exposed will not be exposed by coming into contact with persons who may be infected. This also ensured that those who might have been exposed remain where they are in order to suppress transmission from infected to uninfected persons. Since inbound travel has been suspended, we expect less importation of COVID-19. The country will therefore capitalize on the time during the countrywide lockdown and understand the dynamics of the disease spread patterns in terms of place and in terms of persons. The information is crucial in developing additional targeted interventions focusing on persons and geographic location or potential COVID-19 hotspot. Your Excellency, I cede the floor to you.
Thank you very much. There was additional information. Before I conclude, let me just also add the second priority. Our second priority is to minimize impacts of COVID-19 on our economy. To this end, government rolled out the economic stimulus to the tune of 8.1 billion Namibian dollars on 7th of April 2020. Payment to qualifying beneficiaries has started to be effected today, and so far, over 350,000 applicants have been received. So we are tackling this, and as I'm now concluding, as I have done over the past difficult weeks, I call on all Namibians to remain calm, to cooperate with the authorities in order to ensure that public order is not compromised. Allow the authorities to work unhindered and do not provoke them. But let me add here, other time I said do not provoke the officers, and I saw one of them standing and saying, President said do not provoke us, and showed the AK. Please, officers, let's be professional. These are not our enemies. These are our people. The purpose is to protect them from a disease, but not to be beaten by the army and the police. These are our people who are protecting, many of you are doing a good job. But few who are violating the law will also be dealt with. And they are being dealt with accordingly. But please, officers, all of us as Namibians, let's hold hands. I appeal, therefore, again, to all Namibians to respect the regulations and measures in place to curb the spread of the virus. The pandemic we face today is unprecedented, but I am confident that by working collaboratively, we will respond effectively to minimize the spread of the virus and restore the health of those affected and restart our economy, our economic activities. Let us hold hands and defeat this virus together as Namibians. I thank you. I don't know whether you normally like to ask questions, but there are many people here. But we are getting already 10 o'clock. The update, which I'm watching, excellent. 4 o'clock, another one. So what more do you want? And now here we come to now explain to you new things. Any questions? We have all the experts here. If none, I will close the meeting because we have no time. Yes, hurry up. Why do you take too long when I'm saying questions?
No, excellent.
Somebody must start first.
Trying to double check my info. My name is Blanche from the NBC. Maybe I should direct this question to Minister of Finance, maybe just to give us an assessment or whether there was an assessment made on what the impact has been of the lockdowns on the two economic hubs, regional hubs of the country so far. And then another one is to Minister of Health, where he said that the lockdown or the compliance thereof has not been satisfactory in Khomas and Erongo regions. Now, Minister, in that case, was there perhaps a talk in the meeting, maybe from your side, just to relax some of the regulations, especially when it comes to movement of the people? Because mind you, people who are classified or fall under that category of essential services, these people, unfortunately, a lot of them do not have the luxuries of driving in their own cars and so on, so they will have to take taxis or other public transport to get to perform those essential services and so on. So any talk of some of the regulations being relaxed in that regard, seeing that President GEINGOB mentioned no movement of people with the extension now of the lockdowns? I thank you.
No, don't put it that way. No movement. You have to come and report. Yeah, listen, you will move. There are exceptions. Yes, Minister, who's asked? Minister.
Yes, Comrade President and Branch, the question that you are asking is very, very important. We understand that it's important to protect Namibian lives, but it's also important to protect the economy. So we have to strike the right balance between, making sure that the risk of transmission is mitigated and contained, but also making sure that essential services and important industries that contribute to the livelihood of Namibians are slowly allowed to start operations. We have, I believe you're aware that some of the mining sectors or some of the mining companies are allowed to continue with operation, subject to them meeting the health requirements or the safeguards that they ought to put in place as approved by the Ministry of Health. As to what is the economic impact, of course, obviously, when economic activities are curtailed, it means there's no production, and therefore the economy is sleeping. We are busy finalizing our assessment so far, and I think by the end of this afternoon, we'll probably have a firm view as to what are those economic impacts. So far, the broad numbers that we have is that per week, it may cost us between 1.7 billion to 2 billion per week in terms of loss of economic activity and therefore loss of output. So that's a number that we are looking at. It may be more, it may be less. We are busy refining these numbers, and if you talk to me tomorrow, I will have a firm number.
Yeah, Namibians are interesting. I'm getting a message here. Good evening, Mr. President. My household haven't received any grant of 750. My parents' businesses have closed down, and I'm the only one working. We have kids at home. It is a house of 9 people. I watch you say that people receive 750. Did you hear me saying that? We are really in need. He doesn't put his name or he doesn't put a name. Freedom can be abused. Any other questions? Yes?
Yeah, there was a question, the second question was directed to me about when I said the lockdown was not efficient. I used the word efficient purposely because when you look at the epidemiological data, it shows that the basic reproductive ratio is not yet below 1. And that is the expression of the efficient in terms of the further spread. When it comes to the staff who are doing essential services, their mode of, you said that sometimes they use taxis. As far as I'm concerned, the taxis are still operating. They just need to comply with the measures which are put in place for them to be able to operate, so they can still make use of that mode of transportation. Thank you.
Yes.
Good afternoon, Your Excellency, Ministers. Peter Deng from NBC. Your Excellency, we, just like from the Finance Minister's point of view, the impact of the extension on the economic stimulus package. We have seen 8.1 billion being made available. How is the extension going to impact how is that going to be impacted, the stimulus, now that we are extending it until the 4th of May? The other question is to the Minister of Justice, perhaps just the regulations now. Are we going to see them re-gazetted when it lapses Friday midnight? And then to the Honorable Deputy Minister, the Prime Minister, the issue of the treatments of Africans in China is still a matter that has not been addressed. Maybe we could get a comment from her on that. The other one also is perhaps to the safety and security that we are seeing in some of our residential areas, that people are moving as if the situation is not in these extraordinary times. Maybe are we going to see now people being measures being more aggressive in terms of making sure that non-essential movement is curtailed? Thank you very much, sir.
Yes, Minister.
Thank you, Comrade President. I believe what Mr. Deng is asking whether there will be additional resources that will be provided now that the period is being extended. That is still a question that has to be answered. My appeal to Namibians is that, especially for the emergency income grant, it is a once-off grant. It was a once-off grant, and therefore our appeal is that it must be used sparingly by the basic necessities so that it can carry you through this period. Some of the support, like the loans, that can run for some times. The wage subsidy for affected industries that is still being rolled out, but the emergency income grant is really a once-off grant. Whether it will be extended with the extension of the lockdown period, the need thereof is still to be assessed. My appeal is that the resources are very, very limited, especially during this time, because the economic activities are curtailed, and therefore let's make use of what we are getting. It's a once-off, but we will still assess whether there will be a need to extend that grant and whether there will be resources to extend that grant. So that assessment is yet to be done.
Minister, wait here. The person I was reading I said, no name. Now she said, sorry, Mr. President, my name is Dabandula Ongwediva. Now can she just also by what you call apply?
Yes, I believe if the person who has sent the SMS qualifies, she can apply. But she needs to be within the age of 18 and 59. She must not receive any grant, any social grant, any veteran grant. She mustn't be a student. Of course, she must be a Namibian. She will qualify if she has lost some livelihoods. So my only appeal, because she seems to be saying people have already received money and I have not received anything. My only appeal is that people are still applying. The application period is up to the 30th of April, so she can still put in her application if she meets the qualification criteria. And wait patiently. We have made a commitment that once we have received your application, we are able to process your application within 72 hours. You should be in a position to receive your money. So that's a commitment that we have made, and we will keep with that. We will keep that commitment.
Tapandula, did you hear? Minister answered you. Thank you very much. She's following, so. No, they should be happy to call me here. No. Yes, you are supposed to.
Good afternoon, Your Excellency, media. Thank you for the question, Mr. Deng. I want to clarify two quick things as part of the announcement that the President has made. The first thing is the importance of the announcement is that it is now extending the period of lockdown from the 17th, which is Friday, until the 4th of May. And the difference between the extension of the lockdown now is the time, but the second part of it is that you will remember that initially the lockdown was only concentrated to Erongo and Thomas. It is now being the aspect that is being extended because everything else remains the same across the country. And I want to explain what those are. What remains the same is that there will be no sale of alcohol during this extension. There will be no unnecessary movement from your home unless you go to the pharmacy, unless you go to the shop to buy food, or unless you're essential services. It also means that the restrictions on public gatherings remains the same. So even if you have a wedding or a funeral, it must still be 10 people that should be gathered. So those restrictions that applied since the 28th of March remain in place. The only difference now is whereas we restricted the movement in and out of Thomas and Erongo, we are now extending that restriction of movement to the entire country. What this means is that if you lived in an area that was not initially restricted in terms of movement, so if you stayed in Usakos and you're moving between Usakos and Karibeb, for example, it means now you will require a permit, like it is the case now in the Thomas and the Erongo regions. What this also means is that as we were also monitoring the impact of the regulations on the lives of our people, and also maybe some slight misunderstandings that may have been there. What we are doing now is to review the entire text of the regulations. So come Friday, we intend to have a new set of regulations that will then govern the period that is now being introduced as the extension of the lockdown. I trust that that answers your question. Thank you very much. Thank you, Your Excellency.
Yes, thank you very much. Yes, safety. Home Affairs.
Thank you, Comrade President. Thank you for the question. You see, we needed not really to walk behind people and force them to be in their houses, because our President has been appealing to us to adhere to these measures that are being taken to save our lives. Now, do we really need policemen and soldiers to force us to be indoors and to stay input? I suppose not. But I think, being a broadcaster, please send a message that let's stay home so that we do not necessarily have to be forced to stay there. The possibility exists that you could be forced to stay home. But is that necessary, really? It's not. Thank you, Mr. President.
Yeah, as I just let's hold hands, all of us. Namibian life to me is very important. So really, it's not play a game where the police have to force you or army to force you. They can remind you maybe, but really let's just, for our own safety, follow the rules. Nobody's trying to punish anybody. People are dying. People are dying in thousands at the bigger populations. We are already very small. So let's try to save our lives. That's all we are trying to say. Appealing to our people not to lose Namibian lives. We are already a small population. That's what we are saying. So we don't have to fight over this police to beat you up and so on. No. We are not at war with our own people. They should regard also law enforcement as their enemies, not to insult them. They are risking their lives. Health workers, many of them died in other countries. So only way is really to cooperate. What is difficult in just cooperating? Simple as that, period. Yeah? Internal question. Huh? The question on China. There's a question on China. National relations.
Thank you, Comrade President. I believe the media has been informed that I'm booked for 10 o'clock tomorrow to go to the information center to talk on that issue. But briefly, I can only say, as you are saying, the issue is not addressed. The issue is addressed. Maybe it's only that we have not given clarification. As of yesterday, there has been a long consultation between the African ambassadors in Beijing. And this morning, I had also a long meeting with the ambassador of China, and we have addressed the issue. The Chinese authority made it very clear that it was an unfortunate situation, and it is not the policy of the China to discriminate. And the leadership in Guangdong province have been now directed and informed to say that they cannot handle the situation while understanding the seriousness of preventing the spread of the coronavirus. They have to treat everybody equal. But as I say, that it's been planned for tomorrow at the information center. I'm told that the media has many questions that they want to raise to me, but that is how the issue is being addressed. Thank you, Mr. President.
Yes, sir.
Mr. President, I believe there are some Namibians who want clarity as how the 8.1 billion is going to be deployed, because I understand there are those who are asking questions. If the package is 8.1, why are we only getting 750? Is somebody stealing the money? And understand there are those questions. So I just wanted to provide some clarity in that regard. So the 8.1 consists of different programs. If you recall, the directives that were given by the President is we had 3 goals. One is to protect lives. So we have made money available to the Ministry of Health, for medicines, health equipments, personnel, whatever is needed by the Ministry of Health to protect Namibian lives. So 1.1 billion is going to the Ministry of Health for that purpose. We have also announced that the emergency income grant is targeting about 720,000 people. So that 720, the budget for that is about 560. So it's not the entire 8.1 billion which is going in a form of the emergency income grant. We have also committed ourselves that we are going to accelerate and fast-track the payment of VAT, the money that we owe to business as government, because there has been a significant backlog. So that amounts to about 3 billion that we have to release. So that also forms as part of the money that is going to be released into the economy, so that business are able to get some cash, and they can use that cash to support their businesses and support their workers. We also said we also want to protect jobs. So we have talked about a wage subsidy, where people can borrow from commercial banks and government financial institutions such as Agribank and Development Bank of Namibia, with a guarantee provided by government. So that's also part of the package. And that will amount to about 1.1 billion. So that also needs to be added. And also the payment of outstanding invoices, that also need to be facilitated and fast-tracked. That forms part of the package. So it's not the entire 8.1 billion that will go to the emergency income grant. So the budget for that purpose is only about 560 Namibian dollar. So I just wanted to make that clarity.
Very good. Now, we're just trying to announce the extension. You made it a big conference, press conference. As I said, there are briefings. You can't deny press is cut out. And you have been to that press conferences. You were asking as Republican. When I was asking as you are NBC. But you were saying private media is cut out. You were there as Republican. My friend, you disappointed me. Okay, on that note, thank you very much. And as I said, watch, you have the chance to go and ask these people 24 hours. There is a briefing every 10 o'clock, 4 o'clock, and occasionally we are going to come out and also make important announcements. You want to ask? Why do you always ask this last question to me? I mean, not to me.
I'm so sorry, but I just want to find out perhaps from the Minister of ICT, Dr. Moshelenga, the extension, seeing that schools were scheduled to open on the 20th, or start on the 20th. A lot of unions have come out strongly against that, seeing that there were proposals also made for e-learning and all sorts of virtual platforms. Now, I just want to know, with the extension, will there be a shift in those type of arrangements, or will the current arrangement stand with the extension of the lockdowns? I thank you.
Thank you very much. The reopening of school on the 20th is for the teachers. It is not for the learners to come to the school. So we will announce at an appropriate time as to when learners are expected to return to school. So this does not affect the original plan that government had with regard to the reopening of schools. Thank you.